Hello, I'm Grace McMahon and I'm a student doing the Doctor of Clinical Psychology degree in the Turner Institute for Brain and Mental Health at Monash University. I'm conducting my research in the Victorian Infant Brain Studies group at the Murdoch Children's Research Institute, which is part of the Centre for Research Excellence in Newborn Medicine. We recently published a paper in the Journal of Pediatric Psychology which had two aims. First, we wanted to identify the patterns of depressive and anxiety symptoms of fathers in the first year following the very preterm birth of their baby. And second, we wanted to examine the relationships between depressive and anxiety symptoms over time and fathers' early parenting behaviours. While we knew that fathers of babies born very preterm were at high risk of depression and anxiety in the initial weeks and months following the birth of their baby, we knew little about fathers' mental health beyond these early months. It was also unclear whether or not it was possible to identify groups of fathers who showed similar patterns of depressive and anxiety symptoms in terms of severity over time. In terms of fathers' mental health and parenting, research in the general population has suggested that fathers who experience more severe mental health symptoms such as depression are more likely to show less warmth and be more emotionally negative toward their child. However, the relationship between fathers' mental health symptoms and parenting behaviours is not currently well understood for fathers who have a baby born very prematurely. In relation to the patterns of mental health symptoms, we found two main results. For depression, we found that almost 20%, or 1 in 5 fathers, reported persistently high symptoms over the first year after birth. For anxiety, moderate symptoms were a common experience for fathers in the first year following very preterm birth, with just over half of fathers falling into this group. In terms of how this relates to their parenting, we found that the mental health symptoms reported by fathers in the first year following very preterm birth were not related to their parenting behaviours when their child was 1 year old. This is encouraging news for fathers experiencing depression and anxiety and their relationship with their baby. However, these relationships are complex and further research is needed into the experiences of fathers following very preterm birth. Our findings highlight the importance of including fathers in ongoing mental health screening and support following very preterm birth, as many of them experience distress for many months following the birth of their baby. These findings may also provide some reassurance to fathers of babies born very preterm who have experienced or are currently experiencing depressive and anxiety symptoms, that these symptoms may not necessarily impact on their developing relationship with their baby. It is vital that research continues to examine parental experiences following very preterm birth. We know that this will not only help parents, but also help to support the development of children born very preterm.